Ontario's COVID-19 caseload increased by more than 3,000 new infections today. That's 11 straight days of numbers that high. There are fears the province's intensive care units will soon be pushed to the brink, especially in the Greater Toronto area. As Morganne Campbell reports, some patients are being flown out of the GTA as ICUs become overloaded.
A surge in the number of COVID-19 positive patients in need of critical care is putting an intense strain on Ontario's healthcare system, already under immense pressure.
I didn't think I would ever be in a situation where we would be transferring patients to other hospitals for admission or to the ICU or transferring patients to other neighboring cities.
Lisa Solomon is an emergency room physician with the Scarborough Health Network, where many doctors are worried about capacity issues in the intensive care units.
We're seeing really sick patients with COVID, and in addition, we're seeing really sick patients in general with other presenting issues.
Friday, the Health Network admitted its 300th patient to the ICU. The lack of space has forced doctors to send some of those patients to Kingston General Hospital for treatment, nearly 3 hours away.
When the word came out that we would likely get patients from out of area, the government has asked us to reserve about a third of our existing open capacity.
Kingston General Hospital has recently expanded its capacity for ICU beds. Earlier this month, the province asked hospital CEOs to prepare for out-of-region patients and to share resources with hospitals overwhelmed by the virus. Hospitals were also directed to accept any patient transfers. This practice is common, dating back well before the pandemic, but doctors say not to the extent they are experiencing right now.
As they try and sort of share the responsibility of caring for these patients across the province, the closer hospitals get filled up sooner, and then you start to look to sending them to places that are maybe less affected and have a little bit more capacity at the time.
Provincial modeling shows ICU admissions could exceed 1,000 in less than a month, which means these patient transfers will likely continue. Morganne Campbell, Global News, Toronto.